All right. Hello, everyone, and welcome to the fifth lecture of the Pearls Lecture Series of 2024. My name is Bilal. I'm a final year medical student at the University of Melbourne. And today we're joined by Dr. Jessica Schmidt from University of Wisconsin, who will be presenting on the top 10 tips for a global POCUS training program, which we're very excited to hear about. So for those of you that are new and joining Pearls just recently, I'd like to quickly talk about Pearls as an organization. So PEARL stands for POCUS for Emergency as well as Acute Care in Resource-Limited Settings. And we're a group of individuals from sonographers to ED physicians to now a new brand of medical students as well. And basically our group goes to specific spots across the globe, starting from the Pacific Islands, where we run short POCUS training courses as well. And we like to keep longitudinal training moving forward after we run on-the-ground courses, such as what we're doing today. We also host image review sessions every third Monday of the month, because the lecture series are on the first Monday of every month as well. Now, since the first course of Pearls was ran in 2022, we've run 8 additional courses across the Pacific, and we're actually verging on to entering Africa as well as Asia as well. So it's very exciting as our group is slowly expanding, especially expanding into different regions as well. So today, Jessica, we're really excited to hear from you. Before you get started with your lecture, it'd be really nice if you could talk to us a little bit about your history with POCUS, how you got started into it, and how you use it as a key tool in your day-to-day clinical practice as well.
Yeah, thank you so much for having me. I was really excited to hear about your organization. I think that so many of the things that I'm going to talk about today, you guys are already doing so well and already have in place. And so that's really fantastic. I am an emergency physician and fell in love with ultrasound during my residency training. I did a 4-year training, and so I did some ultrasound during that time. And then I did a fellowship afterwards. So it's a 1-year fellowship in the United States where we complete kind of a focus on point of care ultrasound. So point of care ultrasound applications. And then since then, as faculty, I've really focused on ultrasound training, not only at my home institution, but really globally, any chance I can get. And so I've worked in a few different places globally in South and Central America, and then also primarily Eastern Africa as well. And those have been really rewarding just to kind of see how much ultrasound can change, because it's such a versatile and almost disruptive technology. I think for me, I use ultrasound the most for resuscitation when I have an undifferentiated patient. That's where it's really a key. But I also use it constantly, sometimes for patient reassurance, because say, hey, you're actually fine. Look, this looks really good. But moreover, to kind of narrow my own differential diagnosis, and then really have as a way to kind of help augment my own clinical decision-making in real time, which I think is what the idea of POCUS, which is what I'm going to focus on today, the point of care ultrasound, more than just ultrasound in general, is kind of used for.
Great. Thank you so much for that insight. Whenever you're ready, please take it away.
Sure. So again, thank you so much for having me. I was asked to speak on something maybe a little bit different today. So this isn't going to be about any one ultrasound specific thing like liver ultrasound or gallbladder ultrasound. It's kind of ideas for global ultrasound. And again, this is my own thoughts. So I'd like to say that I have no disclosures except for the fact that these are my own thoughts. And I'd like to put that in context. As I said, I think the Pearls group is doing a really amazing thing. And I think a lot of those things are what I'm going to highlight today. So my focus of the presentation is not about a physician bringing a probe somewhere and doing ultrasound for one time, but really how to work with partners, integrate into local health systems, and build more sustainable solutions. This is just one person's ideas, and I'm not saying that I've created a whole ultrasound network and a whole big ultrasound solution, but it's kind of talking with others, seeing what things have worked, and going from there. And it's within my own cultural framework, my own lived experience, and it's limited by that. These are just some photos of different places I've worked, from Guatemala and Peru to Uganda and Rwanda. Really, my goal in any ultrasound teaching is to create a program where I don't have to be there. And that's what this is all about. And so this is the slide that I think is the culmination and joy of my work. So this gentleman pictured in the tie is Dr. William Okoro. He's one of the physicians in Mbale, Uganda, where I've been working for the past 5 or 6 years. And he started out as a trainee in our program and really took ultrasound, found a passion and ran with it, made it his MPH thesis, did research, and now he's the one teaching and talking about collaborations at our ongoing training sessions. And so to me, that's really kind of where I want this to go. And that's the highlight of where I think global training is, especially any sort of training such as pearls. I'm also going to start the talk with a shameless plug. Because my goal is education and program development, I want to highlight this website, which I've been involved with as well. This is global-ultrasound.com. This is a great website for those who are kind of starting to engage in a POCUS training model, or maybe have some thoughts about more technical considerations. It's sort of what we call a technical guide or toolkit. Many of the people who helped create this website have also spoke on your series as well, I've noticed. So lots of great experience there. Some of the things that it highlights are things like considerations before you go, before you travel, what type of machine might be important, other technical aspects, things like getting a machine across a border, servicing a machine, security, and then a really big chunk on education, learning tools, and ongoing quality assurance or image review, which I think is really important for any sort of ultrasound program, especially because ultrasound is such an iterative model. Also on this website is just added earlier this year, a really cool series of lectures from people on the ground who are using ultrasound in limited resource settings in innovative ways. So these are from Kenya, Haiti, and Peru, respectively, talking about what I think are just fascinating uses of ultrasound in their clinical practice. For instance, Dr. Romeo Wahome, who's in the blue suit from Kenya, is doing serial popliteal nerve blocks on patients with lower extremity injuries from motorcycle accidents, which in my clinical context would be unheard of because of concerns for compartment syndrome. And he's had amazing success doing that. And then we have Dr. Rudy Menager in Haiti, who's talking about convincing surgeons to take people to the OR and using his own ultrasound skills. That's actually a vial of pus that he aspirated from somebody's right lower quadrant. And then Dr. Jackie Estefanero from Peru, who's talking about using ultrasound for the lungs, looking for different pulmonary patterns, including cavitary lesions for tuberculosis and other things. So if you have the time, really fascinating lectures and really well done. So let's move on to this nebulous idea of doing global ultrasound. I think this is the classic square one slide where many of us start here. We have some nebulous goal of we want to do ultrasound or learn ultrasound, but what does that really mean? Maybe you're someone like me, a practitioner in a high resource setting with a goal of some sort of knowledge sharing. Maybe you're somebody in a limited resource setting who says, hey, I've heard this thing about ultrasound and I really want to bring this to my clinical environment, but I really don't know where to start. And there's a lot of jumbled ideas that kind of all get mixed around. And so the goal of this talk is maybe to organize a little bit of our top 10 considerations of what we should think about when we're thinking about planning a global ultrasound program and working forward. So the first part of our top 10 is our needs assessment focusing on goals. So this is just a good note for life in general, but focusing on goals means asking these big questions right at the front. Why are we doing ultrasound training? Is it because we want to increase efficiency or improve diagnostic accuracy? Is it to supplement a diagnostic program already in place? Are you training a cadre of clinicians that are already in practice? Are they completely new trainees like medical students? Are they community health workers or midwives? There's a lot of different models out there, and a lot of this idea of kind of we want to do ultrasound or we want to do POCUS. And I think thinking about these goals up front is really important. And the goals can really evolve over time. I'm just reflecting when doing this talk about my own work in Mbala, Uganda, where we started out really with this focus on building clinical skills in this very limited environment with pediatricians. And then over time, it's really grown as our interests have grown into doing research and into doing more multidisciplinary trainings, and then establishing a credentialing pathway within the institution to have people do ongoing ultrasound and build up credentialing in a portfolio. The second top 10 is a needs assessment focused on education. So now that you have your goals in mind, you need to figure out how you're going to focus on education. And that should not only involve the learners themselves, obviously polling the learners themselves, but also the people who are in leadership and administration. So for instance, if you're teaching in a residency program, asking the program director or the program chair. If you're teaching a more national level, thinking about the Ministry of Health or district or level administrators, what they think are important for people to know in ultrasound. This is just an example of our much more local and limited evaluation that we started with, where we wanted to know at our site what people were using ultrasound for. One thing I found, if you ask people what should you use ultrasound for, they all say OB because that's what they were trained in medical school, and don't have ideas of how ultrasound can be used in so many different other ways. And so we wanted to know who has been using ultrasound for how much and how confident they were. This needs assessment went on quite a bit more, but those are just some of the basic questions. And in asking this, we found out at our site, for instance, before we completed our first training, that a couple of the residents had already done research in the NICU and were familiar with the machine, knew the knobs, and had a lot of experience. That being said, because we had early learners, I think that it's important to teach to the lowest common denominator. And so when we did actually launch our program, we spent a lot of time talking not just about technical things, and then terminology, modes, artifacts, and a lot of what I think people often call knobology, which is just touching the machine, turning on the machine, making sure everybody had a probe in hand. For our educational model, we wanted to have something more interactive. So we had formal didactic lectures, but then we had a lot of hands-on training, not only with models, but with volunteer instructors who spent weeks and months on the ground doing bedside teaching to get people more comfortable with ultrasound in the clinical environment. And then some also asynchronous materials. So I'm a big fan of free websites, as I've already mentioned. So I created, a little WordPress website with our recorded lectures, and then there's some interactive quizzes on there. We created content that reviewed the basic scans we taught that we hung on the machine, so that if it'd been a minute since somebody had performed a scan, they could look at the little cheat sheet and say, oh yeah, when I'm doing a lung exam, I want to use this, looking at this, and so the materials are really important to help learners retain that information. Another part of the needs assessment is really assessing the physical space. There's a lot of physical space needs pertaining to ultrasound. That includes things like physical space to move a machine around where the machine is located, physical other equipment such as a private area to scan and maybe curtains, and then things like servicing power sources and security. Married to any of machine, and I'm sure everybody old machine that radiology used to use and now they don't use, and it's stuck in a closet somewhere and you can't move it, and that's the machine you use. But I think with these smaller, more portable machines, there's a lot of advantages. We initially got the Sonosite M Turbo, which I'm sure many people have used, and we got that machine because there were advantages for the Doppler that we wanted to use for research and the different probe types. But we knew going into it that there wasn't actually a vendor in in sub-Saharan Africa. And so when the machine breaks, it has to be sent with someone back to Europe with potentially a large servicing fee. And so we've also used these smaller tablet models, which are pretty convenient because they're lower in price point, and some of them have really good images. Obviously, the disadvantage is with a smaller machine, it's easier just to kind of, or it's easier to maybe not be able to keep track of. And so having a good place to store the machine, making sure it's secure and doesn't get accidentally misplaced or stolen is really important. Another thing I think that's often overlooked when doing ultrasound, especially in limited resource settings, is access to power sources. So some facilities, this isn't an issue and there's lots of access to power sources, but I usually bring something like a surge protector just in case there are big power surges, and most of the machines have them built in. But even when thinking about doing ultrasound programs, thinking about extra batteries, using portable machines that don't have to be plugged in. I know at our site on the adult ward, there's really only one viable outlet in the entire male side of the ward. And so we're having to constantly move patients around to the bed closest to the outlet when we're doing ultrasounds on the wards. And so having the machine tablet is really nice so that we don't have to be limited by those considerations. Another part of technical considerations, and this is a slide from Dr. Christine Macbeth, is thinking about where you're going to do your teaching in your facility. And we all have done this. We've tried to either crowd everybody around a laptop, trying to see a small ultrasound machine, or project ultrasound images onto a wall where it's not a dark enough room. So obviously we don't all have the advantage of having some really nice TV screen like you see here in the right, where the images show up beautifully. But I think when you're thinking about your needs assessment and you're thinking about kind of how you're going to implement your trainings, thinking about some of these things ahead of time are important so that you can maximize audience engagement so they can actually see the things that you're trying to teach. Another, I think, really important thing is thinking about acceptability of ultrasound. For us, we're all ultrasound enthusiasts, and so we can't imagine a world without it. One can't imagine why people would not like ultrasound. But I think that there are a lot of things that people maybe are hesitant about, and understanding those hesitancies, both with acceptability, how they feel about ultrasound, and then understanding the feasibility at a site of some things that could be limitations are important upfront. So this is a paper by my colleague who I mentioned earlier, William Okoro, and he was assessing healthcare professionals. He's actually done a similar assessment asking of children is going to be something that we're going to want to address if there are things that people are uncomfortable about, kind of talking to them about what the ultrasound is all about. My fifth top 10 is getting all the right people involved. So this is actually not in Mbala, Uganda, but in Kampala, Uganda, where I just was in February. And this is showing kind of the right people who were there to make just this initial training happen that's going to turn into some longitudinal education. And that's people from program directors and the head of the department, but also the program administrator who is so important in helping us logistically with the room and the budget and getting models. And then local resident champions who can really engage their colleagues and classmates to keep on doing ultrasound and kind of drum up enthusiasm. And so I think that having this big team is really important. And, ultrasound, as we all know, is a team sport. Having all these people in place who are all enthusiastic about ultrasound is important. So technology is the slide where it's kind of a love it or hate it slide. We all love technology, especially because we can do things like this, where I'm talking to you from the United States. But there's also limitations, and that's Wi-Fi connections, etc. Again, I'm not married to any one kind of machine, but I think when we're thinking about technology, one of the big things that I like to think about is how we're going to be able to share images between ourselves, de-identified images, so that we can continue to do quality assurance and talk about our scans. So there's some really neat platforms that have built-in educational software, so you can do ongoing QA. And then there's some other things that are on the internet and really free, like Sono Clip Share, which was invented by Ben Schmidt. This is a really neat program where you can upload your cases, and then we can even comment back and forth. So in Uganda, that's what we used at the beginning. We used a USB drive where we took our images off the machine, we put them onto Sono Clip Share, and then we were able to develop our ultrasound portfolios like that and share comments back and forth about the images and quality. A quick note on bilateral buy-in. So as I said, ultrasound is a team sport, a multiplayer game. All parties have to be willing to put in effort. And while ultrasound, I believe, is this, extremely useful and really practice-changing tool, it may not be the right time, and both parties may not be committed. And so doing this needs assessment, talking about goals, and making sure you have all the right people there at the right time is important. And sometimes it's better to put ultrasound on the back burner because there are other things that have to be built up in a healthcare center or system, and ultrasound is not the first one. And so I think knowing when the right time to start is important. I've talked a zillion times about continuing education because, as I said, ultrasound is easy to learn, but easy to forget. In my training, I learned ultrasound fellowship, but even now as faculty sessions. And I think this ongoing continuing education is important for everyone, not just people who are ultrasound in program does it differently. In this Pearls Lecture series, they have the ongoing monthly didactics. I think that's amazing. There are some really fantastic FOAMed resources out there. And then I'm a big fan too of just giving people access to the content that they've already been exposed to. And I've even put all my lectures on USB drives and handed them out so people can watch them again or have some quick recaps. I think that those sort of things help solidify knowledge into an adult learner's mind. I really think that image review is the best way to learn ultrasound because then you get individualized feedback and learning. And so I'm a big fan of ongoing quality assurance. So for everyone on this webinar today that joins the quality assurance and image review sessions, I think that's really amazing. So sustainability is a very big term. What I mean by sustainability is really having ultrasound being practiced in a location with continued peer initial training, who had outside expertise, can then pass that knowledge on to others who can continue to train and perform ultrasound. The problem with sustainability is it's hard. Did extra training in Kampala, Uganda to know ultrasound echo better, and has really been a champion at the local site in Mbale, but he's now been placed at his district hospital after residency's completion. And so the site is losing that local expert. And so his training has to go to his peers before he leaves. And I think passing on this knowledge and making a program sustainable is really important. And the final top 10 is just making sure that we celebrate. I think there's a lot of talk when we talk about global ultrasound about challenges, about how hard it is. And there's a lot of things that are difficult. But doing ultrasound in a low resource setting has been shown over and over to make such an amazing impact on patient care and really kind of shifting how people approach a patient and narrow their differential diagnoses. And I think that we need to really celebrate that and recognize it and talk about it. And I think the more we do, the more we talk about it, the more buy-in there will be from people throughout the healthcare systems throughout the globe in high and low resource settings to really. So those are my quick thoughts on my top 10.